Hello friends, welcome to a new lecture which is a continuation of axillary artery. In our last class, we have learned about the situation of axillary artery, parts of axillary artery and the relations of the axillary artery, that is the first part of axillary artery, to the surrounding structures. So now let us learn about the relations of the second and third parts of axillary artery to the surrounding structures. So the second part of axillary artery, it also runs in the axilla, right? So let us learn about the relationships. I'll just draw it and then I'll just tell it again because there's not much to explain. The only thing is you'll have to visualize things. So it takes time for you to visualize. So okay, first, this is the second part of axillary artery. It is a cross-sectional view. So first you have skin, okay, and below the skin there will be deep fascia. Okay, so this is the deep fascia, skin and then deep fascia. Once you dissect the deep fascia, you will see the most important muscle in the axilla, that is Pectoralis major muscle. You'll see the muscle in the axilla, that is Pectoralis major muscle. So this is the muscle in the axilla, okay, Pectoralis major muscle. And once you dissect the Pectoralis major muscle, now as I have said in my last class, the axillary artery, it is divided based on the Pectoralis minor muscle. If this is the axillary artery, the first part is above the superior to the Pectoralis minor artery. The second part is below or posterior to the Pectoralis minor artery, and the third part is inferior to the Pectoralis minor artery. So this is the third part. First part, second part and third part. So above the second part there is one more muscle which is Pectoralis minor muscle, right? So here below the Pectoralis major muscle you will see one more muscle which is Pectoralis minor muscle, okay, and then below it you will see the axillary artery. Okay, there is lots of space but there will be less space, okay, and then these are the anterior borders, anterior relations. Then what is the posterior relation? Posteriorly at this level you will not have ribs, okay, at this level you will not have the first part, you will have first and second ribs, but here you don't have ribs. So here you will have scapula, and just below the scapula, so you'll have skin. Okay, first let me draw. Okay, you'll have skin, and you will have the a part of scapula. Okay, not even scapula. Scapula will not come to that side. Okay, if I have to draw, just a minute. I'm finding it. Yeah, here there'll be scapula somewhere here. Okay, and from the scapula there is a muscle which arises, that is Subscapularis muscle, which arises from subscapular fossa of scapula. So if this is the scapula, this is the subscapular fossa. So it arises from the subscapular fossa, and that will attach to the greater tubercle. Okay, sit muscle, has sit muscle. So sorry. That will attach to the humerus. So it will start like this and it will attach to the humerus. Okay. So this is the subscapular muscle. Sit muscle is supraspinatus, infraspinatus and teres minor muscle. So this is not sit muscle. So this is a muscle which arises from the subscapular fossa, and it gets inserted into the humerus, upper part of humerus. So this muscle, which is subscapularis muscle, this also forms the posterior border of the axillary artery. So if this is the muscle, here the axillary artery is like this. Okay, so like this. So at this point you don't have at the point where this muscle is, where this artery runs, you don't have this bone, that is scapula. Scapula is present here, but the muscle, axillary artery runs like this. So you don't have the scapula below it, but you have the muscle which arises from the subscapular fossa below it. So that is subscapularis muscle. So here you see the subscapularis muscle. So this is the Subscapularis Muscle. Okay, so these are the branches. This is the posterior relationship. Now, what is the medial relationship? Medial relationship will not change. That is cephalic vein. Okay. Now, what are the lateral relationship? Okay, what are the lateral relationships? Okay, laterally, if you see, as I have said, this is the humerus. This is the thing. Laterally, you'll see the muscles which are attached here. Okay, what are the muscles which are present here? First muscle is the biceps brachii. It arises from the coracoid process and from the scapula, and it runs like this. So laterally you will find number 1 biceps brachii and also coracobrachialis. Coracobrachialis also arises from the coracoid process. So coracobrachialis and biceps brachii, both these arise from the coracoid process. That is short head of biceps brachii only, whereas long head does not arise from the coracoid process. So the short head of biceps brachii and the coracobrachialis, both these arise from the coracoid process and they run like this. So you will have it in the lateral relationship. So here laterally you will see 2 muscles. One is the coracobrachialis and also short head of biceps brachii. Okay, so this is lateral, this is medial. I forgot to mention it. Okay, and there is a nerve which goes around it, that is brachial plexus of nerves. So brachial plexus of nerves, where are they exactly situated? As I have said, in the brachial plexus there are 3 cords. Cords run at this level. So there are 3 cords. One is the posterior cord, the medial cord and the lateral cord. The medial cord, in our previous diagram, that is here, if you see the diagram which I have drawn before in my last lecture, the medial cord is posterior to the axillary artery, right? Whereas the lateral and the posterior cords are lateral to the axillary artery. Now, this whole structure moves like this. See, this whole structure which is like this, it moves a little like this, so that the medial cord, it moves little anti-clockwise direction to say. So, the medial cord will change from its posterior position in the first posterior relationship in the first part to medial relationship, whereas the posterior cord, which is in lateral relationship to the first cord, now travels and lies in posterior relationship to the second part. So you'll have the medial cord in the medial relationship, okay, and the lateral cord in the lateral relationship, and the posterior cord in the posterior cord in the posterior relationship. Okay, so these are the different cords of brachial plexus. And there is one more nerve, which is median pectoral nerve, which supplies the pectoralis major and minor muscles. Okay, so these are the different relationships which you see in to the second part of axillary artery. Okay, let me just summarize the parts so that it becomes easier once again. So anterior relationships, anteriorly you will have 1 skin, then you will have deep fascia, then you will have pectoralis major muscle, and then you will have pectoralis minor muscle. Okay, and posteriorly you have this is the posterior relationship. Posteriorly you will have skin and then subscapularis muscle, and also posterior cord of brachial plexus. Okay, now what do you have laterally? Laterally you have 1 coracobrachialis muscle, and then you have the biceps brachii, that too only the short head of biceps brachii you have it, and then you will have the lateral cord of brachial plexus. What do you have medially? Medially you will have medial pectoral nerve, medial cord of brachial plexus, and the axillary vein. Cephalic vein has already been there in our in the first part itself. It gives cephalic vein, so you'll have axillary vein here. This is axillary artery. So these are the different relations which you see in the second part of brachial plexus. In our next class, we will learn about the relationships of the third part of brachial plexus. So thank you guys for watching my lecture. Please subscribe the channel for new lectures. Thank you.